Here we are going to discuss some important MCQs of central nervous system. We'll be discussing 30 MCQs here. First one, which of the following regarding touch sensation is incorrect? Touch sensation in the spinothalamic tract is more concerned with gross tactile localization. Touch sensation in dorsal column is more concerned with localization and spatial pattern of the touch. Both are correct answers here. Touch sensation is transmitted by C fibers. No, touch sensation is transmitted mainly by the larger fibers. So the answer should be here. The incorrect answer is touch sensation is transmitted by C fibers. Second one, which of the following statement regarding pain sensation transmission is false? Fast pain is transmitted by A delta fibers. True. Slow pain is transmitted by fiber C. True. The pain impulses are modified at dorsal horn by interneurons and collaterals touch fibers. This is also true answer. Uh, Principal neurotransmitter in the pain is histamine. So here, this answer probably is false because principal neurotransmitter in the pain are involved are uh, the glutamate and substance P. Which of the following is a statement is true here? Visceral pain tends to poorly localized and is often referred to the distal sites. It is not actually the distal site, probably embryonically, which have the same origin where there is, it is going to be referred. Visceral pain can initiate a reflex contraction of the nearby skeletal muscles, again, which is not true. Ischemic muscle tends to be persistently painful until reperfusion occurs due to accumulation of the metabolic products such as potassium. Probably this looks true answer. Visceral afferents travel along totally different pathway as somatic sensory afferents in the spinothalamic tract. Okay, so which is also false. So the proper answer here should be ischemic. Ischemic pain. It will remain until the reperfusion, which is because of potassium. Fourth one, opioid act on the following site to produce analgesia. Opioid receptors on afferent nerve fibers of the site of the injury, probably. Presynaptic opioid receptors at the dorsal horn that can release substance P. Yeah, even that's also acceptable. Rostral sites in the brain stem. Yeah, so here also enkephalin acts on uh, the sites in the uh, locus ceruleus or aphomagnus nucleus. Okay, so here the answer should be all of the above. Which of the following statements regarding reticular activating system is false? RAS is important for regulation of alertness and consciousness. True. RAS is found in the anterior pontine region. Okay, it is seen in the anterior pontine region, and most often it is in the middle of the pontine region. RAS is the site of integration of various polysynaptic reflexes, which is true. RAS is responsible for regulation of the heart rate, blood pressure, and respiratory pattern. Okay, so RAS contains most of the vital center, that is cardiovascular regulatory center, and respiratory center in the medulla, which are part of RAS. So the false would be the RAS found in the anterior pontine region. Okay, so it is very diffuse. Okay, so it cannot be contained to anterior pontine region. So answer here is B. Thalamus contain relay nuclei for auditory information, sensory information, postural and balance regulation, and all of the above. So it is going to contain relay nuclei for all of these sensory information except for olfactory. The EEG pattern can be affected by all of the following except changes in PCO2, changes in temperature, yes, it is affected, changes in PO2, and changes in the blood glucose levels. Okay, so EEG pattern are going to be affected by all the three factors, PCO2, temperature, and PO2, and they are not affected with blood glucose levels. So D is appropriate answer here. Which of the following sleep disorder is associated with REM sleep? Nocturnal enuresis, narcolepsy, night terrors, and sleepwalking. So the most appropriate answer here would be night tremors, which is associated with NREM sleep, I mean phase 3 sleep, deep sleep. Okay, so sometimes night tremors can also be associated with sleepwalking, but the correct answer here is night tremors. Which of the following comments regarding lateral corticospinal tract is false? So it contains 20% of the corticospinal tract. Probably true. It decussate at the level of medullary pyramids. No, it decussates at the spinal level. So innervates the lateral nuclei of the anterior horn. True. It controls axial muscle mainly, and so is important for posture regulation. Maybe true. So the false is, I mean, the correct answer here would be it decussates at level of medullary pyramid, so which is not true. So they decussate at the level of spinal level. Regarding corticospinal tract, 30% of the corticospinal tract is contributed by the motor cortex. Yes, 30% of the corticospinal tract is contributed by premotor cortex. 40% of the corticospinal tract is contributed by somatosensory cortex. Yes, all the answers are correct. So answer here should be all of the above. So which of the following statement regarding motor homunculus is false? A face is represented bilaterally on the motor cortex. Um, this is correct. It is located at the postcentral gyrus. No, it is not postcentral gyrus. Postcentral gyrus is for sensory, so it is precentral gyrus. So body parts that perform finely skilled movements have a larger representation on the motor cortex. Yes, the limbs are represented on the contralateral cortex. So that is also even true. So the answer here is B. So which of the following statement regarding lesions in the motor control pathway is incorrect? In right-handed subject, left motor cortical lesion lead to both left and right hand motor dysfunction. Probably this is not uh, correct because it is going to involve only one side. If the right cortex is affected, I mean it is going to affect the motor function of the left side of the body. So in a right-handed subject, the right motor cortical lesion leads to uh, left hand motor dysfunction. It is right. A small local ischemic lesions in the motor cortex adjacent damaged areas may learn to take over the responsibility of the damaged areas, thus restoring the motor function. So sometimes this can happen, which is called as cortical plasticity. So Babinski sign is localizing sign to anterior corticospinal tract lesion. Okay, so whenever there is upper motor neuron lesion or anterior corticospinal lesion, so Babinski sign will be positive. So the incorrect answer here is A, or rather, the answer for this question is A. Which of the following pairing of cortical area and its function is incorrect? The primary motor cortex control basic motor movement. True. Premotor cortex control the distal motor function. So they can't be that specific to control the distal motor function. That is the function of primary motor cortex rather. Supplementary motor cortex planning and complex motor activity. True. Posterior parietal cortex planning and integration of sensory and motor function including learned sequences of movements. So even that is true. So the answer here is the B. Duration of spinal shock in human lasts of minimum of uh, 2 days, 1 week, 2 weeks, and 1 month. Okay. So here they have asked minimum, so it is around 2 to 14 weeks. So the correct answer here is C. So minimum it takes at least 2 weeks. Okay, so it will be 2 to 14 weeks. Chronic spinal patient does not have uh, hyperactive stretch reflex, flaccid hypotonic bladder, so they can have a hyperactive stretch reflex, and probably they cannot have a placid hypotonic bladder because of the increased stretch reflex. Usually it will be hypertonic bladder. Loss of vasomotor control resulting in sweating and blanching of the skin. um, Probably this can happen. Mass reflex to minor noxious stimuli to the skin, so which is usually occurs in the paraplegic patients. Okay, so here the answer is they cannot have a flaccid hypotonic bladder. Which of the following statement regarding decerebration is false? The initial period is marked by spinal shock. Less likely that decerebration will have a spinal shock. The spasticity is due to increased excitability of alpha motor neuron and gamma motor neuron. So this is true. Predominantly, it is because of the increased gamma motor neuron activity, but yes, it is both increased alpha and gamma motor neuron. Pattern of decerebration rigidity varies with the position. Yes, the increased rigidity in extension of ipsilateral limb when head is turned to one side. Okay, yeah, that can happen. Okay, so the correct answer here is yeah. The initial period, it is not marked by the spinal shock. The decortication is marked by intact temperature and visceral homeostatic mechanism. um, Maybe intact learning mechanism. So learning is affected because of the involvement of the cortex. Intact placing reaction also they are lost in decortication. Intact hopping reaction, there also for hopping reaction you require cortex. So the intact temperature and visceral homeostatic mechanism, so where you do not require uh, cortex, so they are intact here. So answer is here A. Stratum sends stimulatory output to internal segment of the globus pallidus, substantia nigra, subthalamic nucleus, none of the above. Okay, so though it sends signals to the internal segment of globus pallidus and the external segment through direct and indirect pathway respectively, but there will be inhibitory impulses. Okay, so it does not directly stimulate the substantia nigra or the subthalamic nucleus. Okay, so as answer is here and none of the above. The chief inhibitory neurotransmitter in the basal ganglia is glutamate. I mean, it is a major stimulatory neurotransmitter rather than excitatory. GABA, yes, it is one of the inhibitory neurotransmitter. Dopamine, dopamine has both D1 and D2. So D2 acts as inhibitory and D1 acts as excitatory. Okay. And acetylcholine, of course, it is in corpus striatum, it acts as an excitatory neurotransmitter. But here, your answer should be the GABA, which is a predominant or chief inhibitory neurotransmitter in the basal ganglia, okay, because it is involved in the more neuronal circuits. Which of the following pairing parts of the cerebellum and its function is correct? Spinocerebellum, motor execution, vestibulocerebellum, balance and eye movement. So both are right. Cerebellocerebellum, motor planning. Importantly, the sequential planning of the sequential motor events, all of the above. Probably here, the proper answer should be all of the above. Cerebellum receives input from the following sites except labyrinth and vestibular nuclei, somatosensory pathway, visual impulses from rectum, and motor cortex. Okay, so cerebellum definitely receives uh, the information from labyrinth, vestibular nucleus, somatosensory, yes, visual impulses from the tectum, but it receives from the motor cortex indirectly. So the answer should be here motor cortex. Destruction of the cerebellum leads to following except hypertonia, dysmetria, dysdiacokinesia, impaired learning of coordination of repetitive tasks. So you can see dysmetria, dysdiacokinesia, they're very characteristic, and there is impaired learning of coordination of repetitive tasks. So rather you will see hypotonia in cerebellar disorder. So A should be your answer here. Which of the following statements regarding semicircular canals is false? The basal end of semicircular canal is in contact with the afferent neurons. Is probably right. Resting membrane potential is about minus 60 millivolts. Probably right. Hyperpolarization occur if cilia is pushed in one direction and depolarization occurs if it is pushed in the opposite direction. Probably this is also true. Perilymph has a high potassium composition. Probably this would be false because endolymph has a higher potassium concentration. So your answer should be here D. Which of the following statement regarding vestibular function is false? The macula discharge tonically in the absence of movements because of the gravity. Probably this is true because they are going to detect the linear acceleration, the macula. The impulses from macula and ventricle allow reflex adjustment of head movement and posture. Probably true. The linear acceleration does not stimulate cristae in the semicircular canal. Probably right because they are going to detect the angular acceleration. Nystagmus is not present in the blind. They will be present in the blind. So the correct answer should be here D. The pain transmission is by peripheral B fibers. Uh, I think no. Uh, it, it is by mainly A delta and C fibers. Okay, so involves cholinergic transmission. Probably no. Can be gated by presynaptic inhibition. Yeah, yes, they are gated by presynaptic inhibition because they can presynaptic inhibition can block the pain transmission is via fast C pain fibers. Fast pain is carried by A delta as we know. So the correct answer should be here C, that can be gated by presynaptic inhibition. All of the following ascending sensory pathways are located in the dorsal column except pain, touch, vibration, proprioception. So fine touch, vibration, proprioception, they are of course carried by the dorsal column tract, where pain and temperature they are carried by anterior spinothalamic tract. So here answer should be the A, that is pain. Regarding reflexes, the reaction time of knee jerk is 0.1 second. I think it's zero point 0.5 seconds. Gendersic manure enhances the knee jerk reflexes. Yeah, it is going to sensitize the knee reflex because increasing the gamma motor neuron activity. Spindles are located in the muscle tendons. No, they are present in the muscle fibers than in tendons. The muscle spindle fibers are innervated by 1B type of fibers. No, I mean muscle spindles they are innervated by 1A type fibers, whereas 1B fibers is for they innervate the Golgi tendon bodies which are there in the tendon. So the correct answer here should be B. That is, Gendersic manure enhances the knee jerk reflex. Sense organ of pain is Merkel's disc, crosses and bulb, naked nerve endings, Meissner corpuscles. Merkel's disc and Meissner corpuscles, they are the receptors for, they are mechanical receptors, therefore probably the touch sensation. Crosses end bulb is mainly for the temperature. So the correct answer here is the naked nerve endings. So answer should be C. In the ANS, beta antagonism results in constriction of the renal vasculature, probably they cause renal vasodilation than constriction. Alpha is going to lead to vasoconstriction. Decreased velocity of conduction in the AV node, no. Decreased velocity of conduction in the his Purkinje system, probably no. Increased insulin and glucagon secretion. Probably this is and beta agonism. In fact, it increases the insulin and glucagon secretion. Particularly, it increases the glucagon secretion to increase the plasma levels of glucose. So answer is here D. Regarding CSF, the composition is essentially same as that of ESF. Yes, of course, it is almost similar to that of extracellular volume. CSF production is 150 ml per day. No, the amount of the CSF present is 150 ml in any given time. The higher concentration of potassium with respect to plasma, it has a low concentration, higher concentration of the proteins. In fact, it has a low concentration compared to the plasma. So correct answer here is should be the composition is essentially same as that of brain ECF. Okay. So this is regarding all the 30 MCQs. Thank you.